Now that you have purchased an AEH Magnia Reader and SAA test kit, there are a few things that you will have to do to set up the reader to run the SAA tests. Connecting the battery. Number 1, turn the reader upside down. The battery hatch is in the bottom of the reader. Number 2, remove the screw of the battery hatch. Number 3, turn the reader over to loosen the battery. Number 4, attach the battery connector. Number 5, lower the battery into its place. Number 6, close the battery hatch with the screw. And number 7, plug the reader into an outlet to charge the reader. It will display when charged. Installing the cartridge holder carrier. Number 1, push the power button on the reader panel. The reader turns on. Number 2, check the display for warning of low battery. If the battery is low, recharge the battery as instructed in the chapter called Recharging Battery. Number 3, remove the piece of cardboard protecting the swing bed. Note, do not throw that piece of cardboard away. Save it for later use. Push the cartridge holder carrier in a slanted position so that the head that goes in first is slightly higher than the other end of the cartridge holder carrier. Calibration of the reader can be checked. AEH recommends monthly calibration check. To check calibration manually, number 1, turn on the reader. Number 2, insert the check calibration card in the reader. Number 3, insert the calibration cartridge. Number 4, press the measure button. Number 5, after the results are ready, record them. Number 6, compare the results with the allowed values printed on the calibration cartridge. Number 7, repeat the steps from 3 to 6 using the second calibration sample card. If the results do not match with the allowed values, clean the sensor head. Once clean, repeat manual calibration check from the beginning. Caution: do not use any liquids in the calibration cartridge. If there are any questions of the functionality of the calibration cartridge, contact AEH. Assay procedure. Number 1, turn on Magnia Reader. Number 2, open the aluminum test pouch. It has 1 cartridge and 1 clear plastic disposable dropper. Insert the cartridge into the reader so that the small arrow on the end of the cartridge is visible and pointing toward you. The sample, well marked S, will remain outside the reader. Number 3, the reader prompts the use of the calibration card from the SAA kit. This calibration card is lot specific to the SAA kit. The card is inserted into the slot behind the display so that the text on the calibration card remains upward and visible. Ensure that the test name, the lot number and expiration date, the calibration card, and test pouch are identical. Number 4, fill the 10 microliter fixed volume mini pipette if using whole blood, and 5 microliter fixed volume mini pipette if using serum. Number 5, place the whole blood or serum in the buffer vial and invert for at least 5 times for complete mixing. Number 6, after mixing, aspirate the mixture in the buffer vial with the clear plastic disposable dropper provided in the aluminum pouch. Place 3 drops of the sample in the cartridge well marked with S and immediately press measure on the Magnia Reader. Number 7, the reader will incubate the sample for 5 minutes. Number 8, the reader displays the quantitative test result and will prompt to remove test. Number 9, after recording the result, remove the sample cartridge from the reader and visually check the control line. There should be a pink control line across the window area next to the letter C. If there is not a pink control line, the test is invalid and should be discarded.